Finally, just one note that is a priority, and that is dealing with Asian American Pacific Island veterans of World War II and veterans generally. One specific example, the approximately 250,000 Filipino troops who joined American forces to fight in World War II. Our country has yet to recognize the sacrifice that these veterans have made for our country. I was a co-sponsor and strong advocate of the Filipino Veterans Equity Act of 2007, which recently passed the Senate. That's an example of the importance of us making sure that the Asian American story is told in our history and that it's not forgotten, and that the leadership that's been shown historically by Asian American Pacific Islanders is fully acknowledged and rewarded. So on all these issues, I'm hoping that we've got a partnership where I'm going to be able to consult with all of you and work with all of you on a consistent basis to help shape an agenda for the future. And with that, let me stop and let me take a few questions from all of you.
Thank you.
I appreciate your attention.
Thank you very much, Senator. And our first question comes from...
Hi, Senator Obama. I'm Marguerite Rowe from the Asian and Pacific Islander American Health Forum. Your words on health disparities and health coverage, I think, are very encouraging. And could you talk a little bit more about what steps you would take to ensure that there are adequate resources directed toward the elimination of health disparities, especially for underserved groups such as the Southeast Asians, Native Hawaiians, and Pacific Islanders?
Well, there are a couple of components to this. As I indicated before, there are a number of groups that suffer from underinsurance. They just don't have access to adequate care. If we are creating a universal health care system, as I've proposed, where everybody who does not have health care is able to buy into a health care system similar to the one I have as a member of Congress, without exclusions for pre-existing conditions, and with subsidies so that every single person can afford it on a sliding scale, so that people may have to make a modest contribution, but it's affordable given their incomes. If we are setting that system up, that will sweep in a whole group of people who want health insurance but simply can't afford it. What we know, though, from studies is that even when people have health insurance, oftentimes minority groups, including certain Asian American and Pacific Islander groups, are still getting inadequate care, less care, fewer screenings. We don't know all the reasons for this, and this is why I am a sponsor of the healthcare disparities legislation that's in the Senate right now. As president, I would make this as a priority. Part of it has to do with us researching and finding out what's taking place when it comes to some of these disparities. For example, are doctors testing less frequently people from certain subgroups? Are they prescribing different treatment regimens? Are there language barriers that are causing some of these problems? We know that one of the problems has to do with insufficient numbers of interpreters in hospitals and in doctors' offices, and not enough bilingual nurses and doctors. And so one of the things that we should also be encouraging is making sure that there are doctors and nurses coming from these various groups, and that means providing scholarships and encouraging their involvement. The funding on the healthcare disparities would be dedicated funding that would be part of our overall public health system. Obviously, the most expensive aspect of this whole thing is actually providing universal health care, as well as the outreach to sign people up for universal care, because sometimes immigrant communities are reticent to interact with what seems like an alien medical system. And so we're going to have to build in funding for outreach and signing people up. But the big expense is just making sure that people have the coverage. And the way we're going to pay for that is partly out of the savings that we get from prevention. We estimate we can save $100 to $150 billion every year just by making sure people are getting the preventive care that they need, the primary care that they need, also making sure that we're managing the chronically ill more effectively, that we are instituting information technologies that will help streamline the system, reduce bureaucracy, reduce error, and improve quality. And then the other half of this initiative would be paid for by rolling back the Bush tax cuts on people making more than $250,000 a year. If we do those two things, we can more than pay for what's necessary to provide everybody coverage, and the component that is dedicated to closing disparities and studying the disparities problems, doing the outreach, that is actually a relatively discrete, modest amount of money that can easily be folded into the overall budget.
Thank you, Senator Obama, and we appreciate your commitment to ending disparities.
Absolutely.
Good evening, Senator Obama. My name is Napali Woody. I'm with the Council for Native Hawaiian Advancement in Honolulu.
Hey, how's it?
Good, how are you? Aloha.
Hey, aloha.
In 1993, Congress passed Public Law 103-150, an apology to Native Hawaiians for the United States' participation in the overthrow of the Hawaiian Kingdom. The resolution also called for a process of reconciliation between Native Hawaiians and the United States. The reconciliation process began in 1999, and one of the 6 recommendations made by the Departments of Interior and Justice was to enact legislation that would give Hawaii's indigenous peoples, Native Hawaiians, a means of self-governance and economic self-determination within the confines of federal law. Congress has been considering legislation to provide federal recognition to Native Hawaiians. National recognized organizations and leagues have gone on record in support of Native Hawaiian federal recognition. My question, Senator, is if elected, what will your administration do to support the United States' commitment to reconciliation with Native Hawaiians?
Well, as a Hawaii native, I know firsthand the needs of Native Hawaiians, the history of neglect, and the violations of sovereignty that occurred historically, and the consequences we see in the difficulties that so many young Native Hawaiians have in their own land. I mean, this is one of the things that always struck me growing up was the similarities between what was happening to so many Native Hawaiian youth and what was happening to African American youth, Native American youth on the mainland. When communities have been targeted for discrimination, when their history has been erased, it has a profound consequence on people. And we can't undo all that history, but certainly what we can do is to make sure that moving forward we are acknowledging and respecting the cultures that were the original occupants of Hawaii. So I'm a strong supporter of my friend Danny Akaka's Native Hawaiian Government Reorganization Act. I voted in the United States Senate to have this measure come before the United States Senate for an up or down vote. And as president, I intend to work with Senator Akaka to ensure that this important bill becomes law.
Great. Mahalo.